So I've been in the field for, let's say, 44 years, but it's really lasted from when I first arrived on the planet. And my idea has been to actually transform the narrative of mental illness and mental health on a global scale during this lifetime. I now feel like I have a foothold in doing that. And with people like you who are also interested in doing that, we have a capacity to actually change the entire narrative, like transforming the narrative of what it really means to be sick and what it means to be well. For many people, the idea is that if they're uncomfortable, there's something wrong with them. The idea being, of course, that if you're anxious or depressed, or you're afraid, or you're having trouble sleeping, or you don't like being in social settings, or you have a memory that keeps returning, or you're feeling scattered or unable to complete a task, that there must be something wrong with you. You look around and feel that people are doing these things, and there must be something wrong with you. It turns out that there might not be something wrong with you at all, and that might just be called humanity. Meaning it's possible that being uncomfortable is a key piece of what humanity is all about. If we look back over time, we'll see that people have been discussing being uncomfortable since the beginning of time. This goes all the way back to the early writings of Plato and Socrates, and certainly goes back to Buddha's time. He sat under a tree for a number of days, and as he walked away, he had cleared up most of human indiscretions and most of the human inconsistencies. But the one thing he couldn't clear up is that life is miserable. And there's a great deal of misery that is inherent in how we take on life as individuals. So being miserable, being in an unpleasant setting, in even an intolerable or unspeakable setting, is part of what it means to be human.